Thanks, Rusty. Meanwhile, for people like those who need the Jesus House, options just keep disappearing. Cuts to emergency mental health services equal packed crisis centers. Our Colleen Chen tells us how that is now starting to impact law enforcement.
Well, Amy, Oklahoma City police responded to over 8,000 calls for help with the mentally ill last year. Many times the calls end up with trips to get help. There are growing concerns, though, on how far those trips will now have to take them.
6497.
Sergeant Richard Lewis spends his days patrolling Oklahoma City as part of the city's crisis intervention team, often dropping off the mentally ill to the county crisis center. There are 112 other CIT officers like him. Their jobs, trying to calm down often violent and delusional patients, are on the cusp of getting more difficult.
These calls are traumatic enough without extending the travel time beyond what's reasonable.
Just 2.5 weeks ago, a call came in. Officers like Lewis had to be pulled off Oklahoma City streets to drive a patient an hour and a half away to Lawton. It was the closest bed available. Crisis Center was full, Griffin Memorial full, Red Rock full, private hospitals full too.
It was frustrating. Once we take them into protective custody, we have really no choice but to deliver them to a state-approved mental health facility.
And since state budget cuts have chopped the number of beds available in Oklahoma, more cases like drives to Lawton are expected in the future.
It's difficult enough, given the resources that we have now, to handle these problems without tying up a lot of manpower, and I hate to think about it getting worse.
Captain Robert Nash says it's an issue that is only beginning and is an issue that affects us all.
In any given year, in any given population, as many as 20% can suffer some form of a crisis. Given that Oklahoma City's population is between 500,000 and 600,000, you take 20% and do the math. You're talking a potential of 100,000 people having some kind of a crisis.
And there is also a lot of concern for smaller agencies that only have a couple of officers and have to leave their areas unprotected to transport patients